everybody. What's happening? I'm trying to figure out if my camera is working correctly. I'm checking it out on the computer because it seems to be crooked. Oh, right on. It looks like it's the right way. Okay, great. Okay, so we are going to talk to Dr. What's up? Hello, Diego. And Kirby and everybody else is on here. We're going to talk to Andy Rosenfarb today. Super excited. I'm just going to share this video. I'm looking at my computer for a minute and wait for everybody to come on. So Andy and I, we met last year at, Andy Rosenfarb is watching. What's up? I'm just sharing the video, Andy, but you can come on the screen anytime you like. Let's see. I think I have to press this invite button. Andy. There we go. So I was saying, Andy and I, we met last year at the Earseed Guys party. So I met the eye guy at the Earseed Guys party. So Andy, I sent you an invite, and I am sharing this video on my other page so that we can get everybody on it and everybody watching. So let me know if you get the invite. All right, I'm going to post this here. Hey, if everybody's on here, say hi in the comments. Let me know where you're watching from. Hi, Deborah. Where's everybody watching from? Let us know. And then I'm just going to share this again. Andy, how do you get in? You should have gotten an invite from me to invite you on the screen. The invite is sent. Oh, that says to watch. And you're on your phone, Andy, yeah? Let's see. Let me see. This is always like, this always happens with the lives. The person who wants to get on can't get on the screen. I don't know why. Andy, do you have a camera button anywhere on your screen that you can press to request to be on the live? I sent you an invite, but that seems to be, let's see. Oh, here we go. Now it should be asking you to add you on there. And then you should be coming on my screen any minute. It says it's adding you, Andy. Get ready. Put your clothes on. Oh.
There we go.
I just told you don't get naked. What's up? I was just sharing this. Yeah, you're on. You're on. I was just sharing this on my other page too. Do you want me to share it on your page?
Yeah, if you can, that'd be great. You're
okay,
better technically than I am, so let's get on it.
Yep, I can barely get people on the screen here. That was the shortest yet. Who did I talk to the other day? It took us like 10 minutes to get them on the screen. Oh, Amanda, when we talked about the student loan stuff. All right, let's see. Let me just share it once more. We'll get everybody. It looks like we have some peeps watching already, which is great. How was lunch? You ate your lunch already? Yes.
All good.
Excellent.
Blood sugar stable.
Good. All right, let me just see. I think I can share it on yours. Yep, okay. So I have now shared it everywhere. All right. Thank you for joining us today, Andy.
Can you hear me okay?
I can hear you fine, yeah. And any, oh, there was a little, was that me or you?
Yeah, that was you. That was me. That was you from me.
Oh, the volume on yours.
That you shared it. So it's buzzing through my phone. If you hear that, that's like anytime there's a comment or something like that. So we'll just kind of ride through that.
Oh, yeah, that. That's from, wait, why is that happening? It's because,
Give me
why?
one sec.
Yeah.
Notifications that I get.
Oh
Let's
my
see if I
God. Yeah,
can turn
turn
that
them
off.
off. Turn off the buzzer. That's super loud on this side.
Yeah. All right. Give me one sec. I'm going to
No
turn
problem.
me
We're on
sideways
hold.
for a minute here.
We're on hold. Everybody watching, let us know in the comments where you're watching from. And how's that? Good? Are you off now? All your notifications?
Should be.
Okay, rad.
Should.
We got a little heart
Yeah.
there. I love the hearts.
If it is, I apologize.
It's okay. You're a popular dude. Oh, Stephanie Young from New Jersey. That's where you are, Andy, right?
We're in Jersey. Yep.
All right, Jersey people. Do you know Stephanie Young?
Yes, I do.
Oh!
I do. I know Stephanie Brown. She's a sweetheart. Yeah.
Awesome. All right, so Andy, start us off by telling us, how did you get into acupuncture? And then how did you specialize in eye acupuncture? Oh, we have people from France, Southern California. Great. Everybody's watching.
Cool. Cool. So I got into acupuncture. I was pre-med. I went to school, undergraduate for pre-med, and I wanted to go to med school. My father went to an acupuncturist for high blood pressure. He'd been on medication for about 10 years and had really good success. So he had thrown out to me the idea of looking into acupuncture, and long and short, I just loved it. It really made a lot of sense to me. I'd done martial arts for years, and I read a couple of books, and just the philosophy, the naturalistic philosophy really made a lot of sense to me, and it was just one of those things that resonated with me really fast. Then I went for acupuncture, and it was cool. Like, I followed an acupuncturist around, and he was like, putting needles in somebody's foot and their arms were moving around, and I was like, how do you do that? So there's the cool factor there. And then I just went, I was looking for acupuncture schools, went out to San Diego, and that's where I decided to go to school.
Awesome. So how much of pre-med did you do before you did acupuncture? Because I'm wondering, because one of the things that I've thought about is like, I think acupuncture would be such a great track after pre-med for people.
Yeah, well, that's like how they do it in China. In China, they start with a paralleled medicine, and then they shift off into Chinese medicine or conventional medicine.
Yeah.
So I decided, like, right before 2 months before I graduated, pretty much college. So
you'd had a lot of pre-med then.
Oh yeah, I was done. I was done and studying for MCATs and all that.
How do you think that has helped you as an acupuncturist, having that knowledge? Because we don't barely get that much in acupuncture school. I mean, we get, basics, but not what you got in pre-med probably.
Yeah, I was a bio and chem major, so I don't know. I guess it just helped me in school with my memorization.
Yeah,
I was absorbing so much information, so maybe in school it helped. I wouldn't say it helped me too much, because there wasn't any education on that aspect. I took courses in economic botany. Maybe that helped a little bit, but just the biomedical structure maybe had some parallel to it.
Okay, and then how did you get specifically into the eyes?
Well, when I was in acupuncture school, and as soon as I graduated, I always knew I wanted to specialize. I just kind of had that in me. Specialization wasn't really that big in 96 and 97 when I graduated. So I first started in allergies. Then I went to cancer, dealing with those specialties, and I lost interest in allergies and burned out of cancer. Then I just kind of fell into eyes about 2 to 3 years into practice, and realized that this was an area of Chinese medicine that there was no books, there was no articles, there was nobody teaching. I mean, when I was at PCOM, the program was awesome, but I had one class on every eye disease, which was like 2 pages. There was nothing.
No.
So, and I was told in acupuncture school, like, don't bother with hearing loss or eye issues because there's nothing really you can do about it.
What?
So
really? They told you
that? Yeah.
They say such weird things in acupuncture school.
Again, it was, and that's because maybe people heard that, and I don't know why, but there just wasn't any information on it, so it was kind of this void in our profession.
Okay. I mean, I don't know anybody else doing it other than you. Is there anybody else?
There are a few others, and I'm training a lot of students now,
Yeah,
so we're
yeah,
trying
yeah.
to create more accessibility for people around the world who need this.
Yeah, awesome. You don't have any courses online yet, do you?
I
Or
do.
you do?
I do. We have online courses, live courses, and books, a lot of information.
Oh, awesome. Okay, because I knew you did the live courses. I didn't know you had the online courses. But anyway, we'll talk more about
Yeah.
that later. Okay, cool. Okay, well, that's awesome. So then you've been in practice since since 97?
Yep.
That's epic. That right there is
Yeah.
awesome.
Yeah.
And you've been in the same spot?
Yeah. First 2 years I was moving around, but yeah, yeah,
That's
we've been in
amazing.
our spot for about there. Yeah.
Okay, awesome. Okay, so you had mentioned to me your acupuncture 48 system.
Yeah, the microacupuncture 48 system.
Okay, so what's
So that was kind of a
this?
newer acupuncture system that I originally learned, which came out of Denmark to treat eye conditions.
Okay,
And I've kind of further developed it over the last 15 to 20 years to a complete system that we just started teaching this year.
okay.
The book on it came out last year, and my students and whoever is using it is getting a lot of success with it. So not just for eye disease, but a lot of other things, and that's what the live certified training is that we're doing.
Okay, so it's like a full medical system. It's not specifically for the eye stuff.
Correct. There's an exceptional benefit to people who are seeking it for eye conditions, but not exclusively for that.
Okay. And then, so can you give like a summary of what it is?
Yeah. So most of the points, it's 48 points.
Okay.
Most of them are on the hands and feet,
Wow.
palms, and soles. So that puts people off right off the bat. People are like,
That's
oh,
intense. Yeah.
put the needles in there. But it's not that bad.
Okay.
People like freak out just the thought of it. But if you learn how to needle correctly, I have a lot of little kids I treat. We have,
Awesome.
thousands of patients that we've treated over the last 20 years with this. It works, and it's just, if you learn how to do it right, it's not uncomfortable. And then we have people who are sensitive. We have little kids, so we can teach people how to do laser acupuncture on these points, acupressure, moxa, direct moxa on these points, electrostimulation. So even if we have people who aren't going to have the needles, they're not going to tolerate the needles, we have other ways to stimulate the points and get really high success rate with that.
So you do teach, though, needling technique. I'm happy to hear that. Okay,
Yes.
so that's super interesting. So what was I going to ask you? So do you utilize the system like with the same types of treatment plans as like classic Chinese medicine?
Yeah.
Okay.
Yeah. So we have, like, for example, you have like your lung points, your large intestine points, your Sanjiao points, your small intestine, heart points, stuff like that. Same on the feet. So they coincide with the traditional meridians. It's showing to be such a superior system for pain and other conditions.
Fascinating.
It's kind of a new system. A lot of people, it's starting to generate a lot of interest, and pain is amazing. We're using it more for internal conditions now. Because it's new. We know some things that it's good for, neuropathies, peripheral neuropathies. But we're going to see what other conditions it is really beneficial for as more students use it clinically.
Okay, that's awesome. And you came out of Denmark, you said originally? Denmark?
Came out of Denmark. There's a Danish guy named Freddie Dahlgren who kind of synthesized the map, so to speak, of the points. But really, him and my teacher, Per Odd, who taught me, just used the system just for treating eye diseases. So I further developed it into a more comprehensive acupuncture system.
Awesome. Yeah, I mean, that's what's so amazing about our medicine is that there's endless ways to treat with treatment protocols and this and that, and they all work, and it's really just like figuring out what you love doing and, what systems resonate with you, and then just utilize that and master that technique, I could see how just hands and feet would be really, it's just kind of really simple because the patient doesn't have to take any clothes off. They don't even have to lay down, I would think, huh?
That's right.
Yeah.
It's very simple, and especially if you're using acupressure, like if you're using a pen, or something to stimulate some of the points, Like it's really easy. Acupressure is so effective, and that's
Mhm.
originally what these systems were made to use to teach people how to do home care therapies.
Interesting. I might be talking to you more
Yeah.
about that off camera because because you know, I love doing the work abroad, and I was looking into more
Yeah,
sustainable stuff to teach local people, you know, and that could be an interesting system just on an acupressure type of basis, you know.
absolutely, absolutely.
Yeah, so that's really interesting. So then in your clinic, you don't do just eyes, or you do everybody, or is your clinic like mostly full of eyes? And Anthony's asking where your office is located. Yeah, anybody watching, if you have questions, ask away. That's why we're here.
Yeah, and if you guys have any friends who are kind of who you think might be interested in this, tag
Oh
them,
yeah, yeah.
put
The
their
tagging.
names in the line and
You're
everything.
good at
So
that.
let's get them in there. So yeah, my office is in Westfield, New Jersey.
Mm-hmm.
Like I said, I've been here for about 25 years ish,
It's amazing.
and yeah, mostly now it's been increasing the amount of eye patients. We're
Mm-hmm.
about me personally, I'm about 70 to 80% of my
Mm-hmm.
practice is treating eyes, but I see everything else. Mostly macular degeneration, glaucoma, genetic night blindness, cataracts, a
Mm-hmm.
lot of dry eyes, one of my favorite things to treat. But yeah, I mean, we see anywhere from, on average, about 250 patients. I see about 250 patients a week-ish,
Mm-hmm.
about
Wow.
between 40 and 60 a day. Yeah, we have 8 rooms running.
Oh my
So
God.
I'm just
You're a
crazy like
machine.
that. Yeah, I kind of psycho like that. It's a fun pace for me. If I see
You're not
like one
psycho.
patient an hour, I'm falling asleep. So yeah.
Wow. Okay. Andrea is saying, I'm interested in finding out more. I'm an acupuncturist and also have an eye condition, wet macular. Yeah.
Yep.
Um,
So we have books, we have trainings, I
mhm.
have videos
Awesome.
on Amazon. We have like 6 books. We have one for 99 cents that's just on macular degeneration. Um, Email me too. Any questions, I'm happy to help you guys with cases and learn more about treating eye stuff. So I'm
Awesome.
always available for you guys.
You are a rock star. Okay, so I'm curious. So with because I know, like for instance, people with glaucoma, you know, they have to
Yep.
go on like horrible eye steroids and stuff like that. So do you get people off of these medications with your protocols?
Sometimes.
Okay.
So with that, people will use eye drops to control the eye pressure
Yep.
for glaucoma, but that doesn't always protect or preserve the vision because people are on these eye drops and they're still going blind.
Yeah.
So I tell the patients most of the time, if you want to stay on the eye drops, stay on that to control the pressure. I'm going to work with the optic nerve.
Yep.
It's a win-win, kind of integrative strategy.
Awesome. Run, don't walk, Kristen says. Andy's great. Run, don't walk. Is that your like motto?
Yeah, sometimes.
Okay, so sometimes you can get off the meds. That makes sense because that I guess is like the basic Chinese medicine thing.
Yeah.
Run, don't walk to see him. I get it. That's what she's saying. Um, so then I'm curious, with your eye cases, what is the like most amazing case of healing that you've seen happen?
Well, every week, I was thinking about that, and
Yeah.
I get asked that question a lot. And honestly, every week and I hate to use the word miracle, but
Yep.
it's to my patients, it is. Like last week, I had a patient who came in who had retinitis pigmentosa. She couldn't see the eye chart. I mean, her vision was so bad, she couldn't see the eye chart, she couldn't read. She had like tunnel vision like this, maybe 5 degrees. And after 2 weeks of treatment, she came in from Arizona. She had diabetes, high blood pressure. This one was not in good health.
Yeah.
Real sweetheart, but horrible, horrible health. Tons of meds, steroids. She got like after 2 weeks, she was reading 5 lines better. She like opened her visual fields from like 5 degrees to 45 degrees.
Wow.
Like crying, that's just like every week. Like people are just like
Yeah.
total non-believers. Then they're total skeptics, and then they read better.
Yeah.
And they're like, I can see better. Like like they can't believe it. So it's just that, like, there's so many cases where people got their driver's license back, or they could have catch with their son because they couldn't throw a ball, or just they couldn't see the expression on others, or they can't read the newspaper, or any of these little day-to-day things that we take for granted. But there's so many daily problems that people deal with that seem so little. But it's the little things that really make so much of a difference to these people. Like a lot of them lose night vision. They can't go to a dim lit restaurant or a movie theater or a nightclub. There's no nightlife because they don't want to walk outside. They can't see in the dark. It's night blindness. So I'll get an email that they went out to a restaurant or they went to a movie theater or they were out past dusk at night in a park and they were okay. So it's the quality of life things that really impact people.
Yeah, that's amazing. That's awesome. I mean, yeah, you are literally changing lives. You know, that's amazing. No wonder you've been just doing this for 25 years and you're treating like 1 million people a day.
Yeah.
So
it's
do you
a lot.
have perfect
it's busy,
vision?
but it's awesome.
Do you treat yourself? Do you have perfect vision?
No, actually, so that's a good story. So when I was in acupuncture school, that's when, I'll date myself, that's when PCs first came out, and I got my first laptop, my first PC. I was doing all my homework on the computer. My eyes started to go. My vision prescription was dropping. I'd worn glasses since I was 6.
Yep.
And I went to an optometrist in San Diego, and he's like, what are you doing? Your vision is like really decreasing rapidly. And I said, I'm using computers, I'm doing all. So long short, I started doing acupuncture and went back to him, and he's like, your astigmatism's gone and your vision is like 2-3 lines better corrected. Wow. What have you been doing? Acupuncture. And that was my first indicator, and I didn't run with it from that point, but it worked. Like I knew right off that it worked. I was like, okay.
Yeah, that's awesome. All right.
Yeah.
Let's see. Anthony here is saying, I'm currently, can you see these comments, Andy? Are they on your side too?
No, because I'm on the phone.
Okay.
I'm on the phone, so I'm deferring to you for the
That's
questions.
fine. I will read them. It says, I'm currently in the J site clinical trials in Beverly Hills. Do you think a combination of stem cell treatment and your style of treatment would be a breakthrough? I'm fighting against RP.
Yes, retinitis pigmentosa. So that's what we were talking about, genetic night blindness. So here's the thing. Stem cells work, and we're not sure how much they're going to do for these. There's a lot of research going on with eye diseases. The biggest problem and solution that we have with using integrative therapies is the stem cell research is missing one critical thing, and it's fertile ground. That's pretty much what we're looking at. So stem cells implant into the eye, and they'll form retinal cells or macular cells or optic nerve cells or whatever. But if the environment is so inflamed and toxic and poor blood flow and oxidative stress and metabolic waste, when you plant those seeds, aka stem cells, they're not going to germinate and they're not going to grow into healthy, mature stem cells. So what we're doing is using acupuncture to increase the blood flow, reduce the inflammation, clean up the environment so that the stem cells, once they make it to the eye, they'll stay and they'll grow. It's like, why can't we plant a garden in New Jersey in January? Because the conditions aren't right. The environment isn't conducive. So we want to create fertile ground and improve the environment. If the environment is hospitable, the stem cells will grow. So
that makes a lot of sense.
To answer your question, an integrative therapy using stem cell and things like acupuncture and or other holistic therapies to deal with all the systemic inflammatory issues and other autoimmune or inflammatory or oxidative stress or dehydration, whatever issues are going on, that's going to really help make a better outcome for patients, for sure.
That makes a lot of sense because that's like IVF. You know, that's why acupuncture helps with that.
It's exactly the same.
Yep.
No different.
Yep, makes a lot of sense. Okay, let's see. Melba Taylor. She says, I've been a patient for 4 years. Yeah. She says her RP has not progressed during the past 4 years. So grateful to Dr. Andy. Miraculous, yes.
Mwah. Love you, Mel.
That's awesome. People are saying hello. Elena, Dudnick, Joshua, Seward. Anyway. All right. So awesome. Anthony, who asked about the RP, says, thank you for your reply. Awesome. So the people that you're teaching, Andy, do you have a network of them somewhere where like someone can find a practitioner that's been trained by you?
Yes, that's in the works. So basically we have 2 levels of training for people who are interested in learning about treating eyes, which isn't for everybody, but it's for those people interested. We have the first level is a class that we're doing actually in 3 weeks through Chinese medicine that works in Syracuse, New York, and that's your basic TCM ophthalmology foundational class. So we marry that with the microacupuncture training and certification that we're doing, and those two classes really give people like a very good place to start. They have almost everything they need to get started in treating eye conditions. We're going to be creating advanced courses, and for people as they get more savvy and experience with these conditions. But those are the basic courses for people to get started. As that builds, we are in the process of building a directory.
Yeah,
so people are going to be able to go online and say, hey, I want to find somebody in Texas.
Okay.
I want to find somebody in Australia. I want to find somebody in Israel. So on and so forth. So we're going to have a world global directory of anybody who has certified training. Because we want to make sure that people seeking somebody who does this has a kind of a higher level standardized training than somebody who just kind of like read the book.
Totally.
Or is going to poke and pray.
Yeah.
Or try, So we really want to create a standard for people who are doing this.
Awesome. Yeah, that's awesome. You have another patient on here, Kristen Summer. She says, patient for 5 years, love him, great success also with her RP. Yeah, so super good with RP. Okay, Elena's asking, she says, great to see you, Andy. Can you please say more about hand points, and do you have any books? She must have missed that part. Yeah.
So on Amazon, all my books are on Amazon. If you hit Andy Rosenfarb, there's a list of 6 of our books. 3 are on conditions, and the other 3 on Chinese medicine. We actually have a 7th book coming out this year that I co-authored with Mark Grossman and a couple other guys and girls. So, but for the microacupuncture training, it's called the Black Book of Microacupuncture, and you can find that on Amazon. That has all the hand and feet points, and then that's the course manual to the live training that we do here in New Jersey.
Okay, cool. And then somebody's asking about your online training. Where do they find that?
Hit me up. I'll post that. After this, I'll post that on the feed.
Do you have a website with it or not? Not yet?
It's not on my website, which is AcuVision Acupuncture. You can go to there and look under practitioner training or training for acupuncturists, and it's under there. But I will post a direct link after this for you guys.
Cool. Great. And then Anthony, who asked a question before, is asking, do you have a recommendation for someone in Southern California that he could visit? Do you know if you've trained anybody there? Who?
Gail Brent.
Gail Brent.
Gail Brent.
Got that, Anthony? Gail Brent.
You met Gail. You met Gail at Ellie's.
Oh, I did? Awesome.
Yep.
At the Acu party. That was a great little hug.
Yeah, we did. That was awesome.
Okay, cool. All right, everybody's saying thank you. All right, cool. So you have a lot going on. I love it.
I have a lot going on.
Yeah.
I do.
And so are you just, when you do your live courses, is it just on the East Coast, or do you do it across the United States? Are you doing it worldwide yet?
The microacupuncture training right now I'm doing in New Jersey only.
Okay.
Just because there's a lot involved in that. I have to get tables there, so I have to bring like everything in my office over to the hotel. But the TCM ophthalmology training, we do that worldwide. I mean, I've done it in Australia, I've done it in Switzerland, South America we're looking at. I may do a training in Holland and Netherlands this fall. So that's kind of international. Yeah.
Okay. Okay, great. Please type the links. Yeah. Andy will put up the links after we're done chatting. And then somebody's saying that directory is an awesome idea. They want your directory.
We got it in the works.
In the works,
I promise.
In the works. Okay, awesome. All right. Well, does anybody else on here have any other questions? And then let me think if I have any other questions. Let's see. So do you have people come to you also just to get better eyesight?
Yeah, great question. So yes, we do have people come with myopia or presbyopia, aging eyes, you know, kind of after 40, you kind of get this thing. That's like, it's a side effect of what we're doing is relaxing the eye muscles so the eyes actually work better and accommodate and focus better. Okay. So yeah, on average, most people are going to get 2 to 5 lines improvement just from, you know, just basic acupuncture that we do.
2 to 5 lines on the eye chart thing. That's incredible. On average,
yeah.
That's a lot.
Yep. That's a lot.
And then is it like like you treating a patient like a chronic condition? So it's like over 10 treatments kind of thing?
Yeah. So, and again, most of the patients who deal with these neurodegenerative eye conditions, right now it is ongoing. It's a treatment that, it's kind of like MS or Parkinson, like there, it's not like an acute type of thing. So there is some degree of maintenance. We're always trying to get patients to come in as little as possible. That's our goal.
Yep.
I have some patients who come in, who live local and come in like twice a month, and then I have patients that I see every 2 to 3 years because they're stable. So basically, the more stable people's vision are, the less I have to see them. It's like any other condition.
Yep.
Somebody's got back pain, it's stable, comes and goes infrequently, we're not going to have to see them very often. The more unstable things are with any condition, in this case with the vision, obviously the more intervention and the more treatment they're going to need.
Yeah. And it's like anything else, I would imagine their lifestyle affects their eyesight. Yeah.
Of course. Stress, sleep, exercise, diet, nutrition. So there's a lot of coaching for patients on that. And what's horrible is these patients are told that there's nothing that can be done for them. A lot of these people they write off to them, say, okay, for macular degeneration, retinitis pigmentosa, a lot of these other conditions, there's no hope. It's basically like go home and go blind.
Yeah.
So that's not okay
Yeah.
in my book, because there is so much, which is a half truth, because in conventional medicine there's no drug and no surgery. So yeah, there's no conventional treatment, but outside of that, there's so much that can be done to help preserve people's vision, slow down the progression at least, and try to recover vision long term and help people keep the vision they have long term.
Yeah. I mean, and this is exactly why we need to integrate, because we need to
Absolutely.
help fill in each other's holes, of where
Absolutely.
one medicine lacks, because together it's just, it's amazing. It's unstoppable. Elaine is asking, do you treat the eyes only on the hands?
No. We do local points. Depends on the condition. So microacupuncture is one system I use. I know a lot of acupuncture systems. So sometimes we'll do local points, back of the neck points. Depends on each individual case. It's not like a one size fits all thing. So we do use the microacupuncture and any other system that I feel is going to be beneficial.
Okay, yeah. It's funny. I remember where you were just talking about how you relax the eye muscles. I've heard this urban legend, I don't know, over the last decade or something, that for people who are losing their vision, there's like these eye exercises that you do to move your eyes like a bunch every day to strengthen the muscles.
Yep.
But that sounds like opposite rather than relaxing the muscles.
No, so what happens, it's like I was on Dr. Oz 2 years ago, and this is what we talked about. So it was all about eye exercise for aging eyes. So what happens is the muscles get tight. Like your back will stiffen up if you're not using it.
Yep.
So they often say do exercise, stretching, yoga, Pilates, rolling, massage. Anything that moves the muscles is going to increase its elasticity and flexibility, and it's not going to create so much tension.
Yeah.
Because like now we're on screens, we use screens so much, our eye strain, the tension gets so much around our eye muscles that we need to do exercises to relax them and keep our neck muscles relaxed and our temple muscle relaxed. So relax all this, it keeps them fluid and moving and not, tight.
Okay.
So,
how much do you think blue blocker glasses help people?
So important.
Okay.
So even now, just glasses with the blue light filter on it and the screens with blue light. Blue light is really, if we spend hours and hours and hours on our screens, we need the blue light protection.
Okay.
Not only from screens, but also from the sun. So it's a big deal.
Okay. Joshua Stewart is asking, do you offer residencies where I could come by your office and shadow?
Yes. After we do, everybody who does the trainings, the microacupuncture training and certification and the TCM ophthalmology, we do that, make that available for students after they've completed that training.
Awesome. Marshall Decudo, who's from France, he says, can you comment on a medical diagnosis of drying retina? Had my retina scanned, which shows an age-related separation of the retina, and my symptoms are occasional flashes in my lateral visual field.
Yeah, it's got a dehydration of the retina. It's either the oils are too low, the fluids are too low, and or there's a driving inflammatory process, so we need to figure out what that is. There's got to be some inflammation involved. But anything that dries or the retinal tears or detaches, it's because the retina, which is the inside of the eyeball, it dries out and shrinks.
Wow.
So that, like anything else in nature, it dries and cracks. And so we have to look at dietary things like fish oil and hydration and getting the fluid levels up, eating things with more good fats in your diet. and then also looking to see what kind of inflammatory markers are going on, allergies, infections, lifestyle, alcohol, medications, anything that's accelerating dryness can be contributing to that for sure.
Okay, awesome. That's really interesting. So that's like a yin thing, huh?
Yin
Major
deficiency
yin.
and yin kidney fluids. Yep. Liver, kidney, yin, and fluids deficiency for sure.
Yeah. Let's see. Bob is saying, thank you, Dr. Andy, for your helpful advice. I appreciate you. We have some thank yous. Oh, Marshall from Bermuda, living in France. Okay, and then Elena is asking, do you use scalp acupuncture as well?
I do, mostly for eye stroke.
Oh.
If there's a stroke in the eye, I found that eye stroke seems to be one of the best responsive for that. We actually do scalp acupuncture points and like Yu Yao and E-stim those. Gets really good results for eye stroke.
Awesome. Elena says, please do some classes in the UK.
In the works.
And then Marshall says, I'm coming to visit next time I'm in New Jersey. Thank you.
Awesome.
Yeah. All right, cool. This has been super interesting. Fascinating. I knew it would be. The eye guy.
That would be me.
All right, cool. So you have your live classes, you have your online classes, and you have your books. And then you'll put up a link for where to find that stuff. And then you get your books on Amazon. And then that's it, yeah? When is your next live course?
May 18th, 19th in Syracuse.
Okay.
Through Chinese Medicine That Works. And then our summer class for the microacupuncture training is full, but we have a couple spots left in February, and that's going to be the last microacupuncture class that we do this year.
Awesome.
So.
Okay. And then when we were chatting on our messages, I love that you said you have 4 coaches.
Yeah. Yes, I do.
So are you like a coach dude? Because you have obviously, I mean, you have some awesome, mega, huge success, and you're making a huge impact in the world, you know, and I really want to acknowledge you for that, for everything that, you know, you're adding to our profession, and for how many people, you know, you're really helping and changing their lives. And now you're gifting this forward by teaching other acupuncturists how to do this amazing system. Like, mega mad props, acknowledgement for that. That's unbelievable.
Thank you.
Unbelievable what you're up to.
Yeah, coaches, it's so important to have a coach. Just I've pretty much always had mentors and coaches. For me, I have like a fitness coach who helps me out with like keeping, you know, my physical side of it. I have business and marketing coaches and you know, sales coaches, and somebody to help me with my funnels and stuff like that. So it's kind of different coaches for different areas of my life. Yeah, you have to. You know, for me, one of my success secrets is finding the right person. Again, there's going to be the right coach for everybody, but it's finding the right coach not only to create a successful practice, but it's all about creating a successful life. So my lifestyle has to be great, health, marriage, my relationship with my kids, my spirituality, my connections, my, you know, hobbies and interests and stuff that I do. So there's success in practice, and that's a small part, but that has to lend itself to a successful life. And that's why, you know, having coaches like you, Alyssa, who, you know, you find people that resonate with you, that, you know, kind of get your message and see value. And everybody should have a coach, in my opinion. There's just stuff that you can't. And for me, the way I see it, I've learned for this the past 20 years, is the best coaches will kick your butt, then give you a hug. They basically they will, and they'll show you a mirror of what you're doing and what you're missing.
Yeah.
So it's, you know, you can't see how you're running, and a good coach will give back to you what you need and really challenge you in ways that you probably wouldn't level yourself up for whatever reasons.
Yeah.
So yeah, if you want to create not just a great practice, but a great lifestyle, and enjoy your life and enjoy that, it's important.
That's what I'm all about, man. Like I was saying, you want to be a successful and happy acupuncturist, you know, and that looks different for everybody, you know, so that's so important. And they go hand in hand, you know, when you're happy, your success just goes through the roof, you know? So,
True.
All right, let's see. Elena, yes, you'll be able to watch a replay. Pamela Howard put up accuvids.com. So she put up a link for us.
Awesome.
And then, let's see, Anthony says he's going to find your links. Elena says, thanks. All right. Awesome. Well, Dr. Andy, you are awesome. We will have to do a chat again at some point.
Absolutely.
Yeah, for sure. And, you know, if you ever, you know, once your system comes out, your 48 one, we can even get more into that on another chat if you want. It sounds super interesting.
Yeah. Microacupuncture, it's great.
Yeah, super interesting. And thank you so much for coming on and chatting during your lunch break.
I appreciate you having me. It was so much fun.
Yeah, totally. And people are saying thank you and wish you the best, Dr. Andy. All right. So then we will talk soon.
Thanks,
And thank
guys.
you so much. Bye,
Take
Andy.
care.